So it's a pleasure and an honor for me to now invite Dr. the Honorable Christopher Tufton, Minister of Health in Jamaica, to address us. Minister.
Excellencies, distinguished delegates, colleagues from the region, Jamaican delegates who are here, Ministry of Health officials, NGOs, ladies and gentlemen, good morning to you all. I do like a combination of orange and green. But it does symbolize a unity of purpose. And the Jamaicans would understand the joke. Let me also welcome, as was done by Sir Trevor Hassel earlier, all distinguished guests from the Caribbean region, and especially those from the various collaborative agencies and universities, as well as, of course, the health team and supporting NGOs who are based here in Jamaica. We are indeed happy to be the host country for the Healthy Caribbean Coalition NCD Forum 2018 under the theme Supporting National and Regional Advocacy in the Caribbean in the lead up to the 3rd UN High-Level Meeting on NCDs. The main objective of today's event is to mobilize civil society organizations from across the Caribbean and other key stakeholders to ensure that Caribbean civil society is fully engaged in the 2018 UN High-Level Meeting on NCDs. We are happy to partner with Healthy Coalition for the Caribbean on this Caribbean NCD Forum that will provide these civil society organizations in collaboration with governments to take stock of the progress achieved since the 2011 and 2014 high-level meetings and share regional successes and lessons in NCD policies and programs. This year, the world will take stock of the NCD progress in September 2018 and will chart a roadmap towards meeting the 2025 WHO targets on sustainable development goals. Caribbean leadership was central to the movement that galvanized the world towards the 2011 United Nations Political Declaration on Non-Communicable Diseases, recognizing NCDs as the greatest public health challenge to develop of the 21st century. The Caribbean had the first ever political commitment in the world to fight the NCD epidemic in 2007, over 10 years ago. However, progress has been slow and uneven in the Caribbean. The region has the highest rates of premature mortality from NCDs and obesity. Childhood obesity is increasing rapidly. 3 out of 4 people die from an NCDs in the Caribbean. 40% of deaths occur between the ages of 30 to 70 years old. 41% of these deaths due to cardiovascular diseases. This, of course, is according to the Pan American Health Organization. There is, delegates, ladies and gentlemen, an urgent need for the Caribbean to accelerate the implementation of the NCD response if we are to meet the agreed regional and global targets. The UN high-level meeting in September is an opportunity for the Caribbean region to reaffirm its commitment and to share our success and challenges in combating this epidemic. The CARICOM region has been successful in combating vaccine-preventable diseases, reducing maternal and infant mortality and premature death due to HIV/AIDS. Political leadership and commitment is critical, or is a critical element for success in tackling the NCD epidemic, along with the investment in a package of cost-effective interventions with a focus on prevention. As Minister of Health, I am only too cognizant of this, and this is why we in Jamaica are working towards accelerating our response. In other words, coming out of this discussion over the next few days, It just cannot be business as usual. We must also accelerate universal access to care with an emphasis on primary health care for many. Primary prevention is sometimes too late and must be able to provide accessible, patient-centered, high-quality care to prevent death and disability from those who already have an NCD. Again, as Minister of Health through the Jamaica Moves program, and we have a pop-up poster there to give a little indication of what that program is. Through also the National Food Task Force, Industry Task Force, and the Bloomberg Obesity Prevention Project, which we do in collaboration with the Heart Foundation of Jamaica. We have been able to galvanize a whole of society response with civil society, private sector, intergovernmental, governmental, faith-based response that cuts across any political divide. We have pooled our resources to support the national response. At the end of this forum, the delegates will arrive at a consensus on NCD priorities to take the UN high-level meeting on NCDs. This will form the CARICOM Civil Society Organization statement on NCD priorities, which will be presented at this high-level meeting, and the 39th Annual CARICOM Heads Conference in July 2018. Our efforts here in Jamaica, including the Jamaica Moves effort, serves as a platform, we believe, for a Caribbean Moves that shows regional commitment focus in tackling the NCD epidemic from a preventative perspective in the first instance. In closing, I want to say thanks to the participating players here today, the stakeholders, the Heart Foundation of Jamaica, Jamaica Cancer Society, the Diabetes Association of Jamaica, Pan American Health Organization, and the Caribbean Public Health Agency, CARFA, the University of the West Indies Open Campus, and all other participating entities who are represented here. I saw and took note that almost every English-speaking Caribbean island is represented here in one form or another. And that augurs well for the collaborative effort which we will participate in and take on. While we work, finally, please enjoy the Jamaican hospitality. There's a lot to do, there's a lot to see, and let us, at the end of the next few days, come away with a renewed focus to tackle this very critical issue and chart a course that will see us achieving the success that we hope for the people of the Caribbean. Thank you very much.